Hey, this is Doug Field along with my co-host, Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. Join us on the program today to really talk about the impact of mobile health and mobile health trends is the team from ICF International, Rachel Adler, Steve Ferguson, and Frank Wang. Good morning to you all.
Good morning. Thank you for having us today.
I don't have them. You got them? I have nobody. Hello?
Good morning. Thank you for having us.
Hey, Rachel. Talk to us a little bit about what you guys are doing there at ICF International, and we'll kind of dig in a little bit more into some of the questions that you guys have here.
Sure, great. So just a little bit of background about ICF International. We are a global consulting firm. We are based in Fairfax, Virginia, and are about 5,000 employees and growing. We do various consulting work across industries, including health, energy, and transportation. But certainly a big, significant focus of ours is the healthcare industry. Our clients range from federal work as well as clients in the commercial space. On the federal side, we're doing work with clients such as NIH and CDC. And on the commercial side, we are working with both providers and payers, but a large portion of our work is in the payer space.
Rachel, now when you look at kind of the mobile piece out there, especially in the healthcare space, kind of what are some of the struggles that you guys see, and what are some of the strategies that you guys are taking to kind of help find solutions in that space?
Sure. In the healthcare industry, I don't think it's new news, but the healthcare industry is really behind when it comes to their mobile presence. If you think about it, we look at other industries such as banking or airline industry. They've come to be a point where we fully expect to see a mobile presence. We want information on demand. And that is quickly where the healthcare industry is turning as well. With healthcare reform, obviously there's been this huge pendulum shift from moving from a B2B type marketplace to B2C. Our clients are really starting to have to focus on their consumers. And when we're talking about our consumers in the modern day and age, we're really needing to think about what that means as a mobile presence. To answer your question about where are some of the biggest challenges that we're seeing with our healthcare clients is almost a little bit about, where do I start and how do I tackle it? Some clients are still needing to get up to parity just to be able to have a mobile presence, and some are a little bit further beyond in their expertise on where they want to go. But one kind of common denominator that we do counsel our clients on is really making sure that they, as an organization, understand where they are now and where their long-term goals are. An issue that we see companies doing is becoming a little bit too focused on the tactical without really understanding the bigger picture. And sometimes that does get them into some problem spots where they're so focused on tactical and they get further down the road and they've forgotten to look at the big picture, and it gets them into a tricky situation. So I think probably if we were to overarching say the biggest issue is just really have a good understanding of where you are, where you need to go, and who you're trying to reach out to with your mobile strategy.
Frank, when you talk about consumer facing, it's really important to really work on the user experience. So what are you guys doing specifically around improving that user experience for these healthcare organizations?
Absolutely. I think the main thing there is to, gain a good balance of different types of inputs. So a balance of both, qualitative and quantitative inputs when it comes to gathering user research. And so, for example, a lot of times an organization will just rely on analytics data, for example, or they'll just have some survey data, but that really doesn't give you the whole picture. That kind of tells you some of the what is going on, but doesn't really tell you why some of the numbers are what they are. And so we help organizations balance that better by having both the numbers. So it could be analytics, it could be service, it could be both, but also add to that some qualitative input such as usability testing or focus groups or one-on-one contextual interviews and things like that. And so putting all those different pieces of the puzzle together really helps inform a more complete picture of what consumers are really looking for.
Hey, Steve, give us an example of a mobile app that you've put in place that has really benefited consumers.
This is Rachel. I can
Rachel.
talk to you a couple quick examples, and I know Frank has some as well. But we've done, recently, we have for a smaller regional payer, have put in their their mobile application to help their members see claims information, find provider information, and really just have the data that they need at their hands. And one of the pieces of feedback that we've gotten from this application, outside of the fact that the feedback's been that it's very user-friendly and members are thrilled to have this information when they need it, where they need it. But in addition, we've got some feedback that the payer organization is actually taking this application with them when they're talking to their brokers. So the people are actually out selling their products. And the broker's feedback is, hey, this is really great. And the brokers are using it as a selling mechanism to say, hey, look at this organization. Their mobile presence is just, a bit of what they do. And it's really giving the feel of the local payer of having really strong roots, and people trust the app, and therefore they trust the organization, and it's been really spiraling that way.
So the brokers are using it as a real value-add, innovative tool to separate that health payer from the rest of the pack, so to speak.
Yeah, exactly.
Yeah, and another example that I can share, Rachel talked about our work with CDC earlier. We, besides just a single mobile application, we designed and developed an entire content application framework that allows CDC to leverage their existing content that they already have from the public website, and this mobile framework allows them to efficiently adapt and publish that content, as multiple mobile apps, that are targeted to specific topic areas. And the mobile apps not only provide that quality content, but also allows users to highlight, make annotations, and share that critical content. And we're extending the same idea for the Department of Veterans Affairs as well.
Interesting. So let's say you were CEO of a health-focused company, and you were way behind the curve. How do you talk to them? How do you help them?
So this is Steve. There's a couple of things you can that I think we would guide them on. First is really assess where you are today with your digital strategy, and that gets back to what I was talking about earlier in terms of what are you hearing from your customers, and you need to recognize that your customers aren't necessarily the same as your competitors. So you really need to make sure that you're not just adopting a competitor strategy, thinking there's a one-size-fits-all out there for mobile. You really need to understand what is unique about your clients and figure out what you can do to really help them. And then, in addition to that, you need to really figure out where does your mobile strategy fit into your broader consumer strategy. So what are you doing within your portal and your web space? What are you doing from a social media standpoint? What are some of your traditional marketing efforts that you're tackling? Mobile really can't just sit out to the side. It really needs to be incorporated into your broader consumer strategy. And then ultimately that, leads to a roadmap that you would lay out to figure out where you can make the investments and really get the biggest bang for your buck. The other thing I think we like to advise organizations on is they really need to consider what this means from a cultural shift within their organization. So just putting a mobile application out there or doing some mobile capabilities, that alone doesn't shift your organization to be a consumer-focused organization. These are the types of things that you really need to do some ongoing care and feeding, and you need to look across your enterprise to determine what are you doing overall from a consumer engagement standpoint. How does that fit into your customer service strategy? So, it's really a commitment that you need to figure out where to start first. And, I think it gets back to the adage of, in order to move forward, you need to take at least the first step, and you just need to determine how far you can go with that.
No, I think, and I'll actually pose this question to all three of you, the mobile marketplace moves so fast. And if you guys were look into your crystal ball, and Steve, I'll start with you. Where do you kind of see the market moving 5 to 7 to 10 years from now?
So one of the things that I think companies need to really recognize is the demographic of people who are using mobile is continuing to evolve. One of the statistics that's out there is that one of the fastest growing demographics adopting mobile are those under $30,000 who make under $30,000 a year. So you need to consider that the mobile market is exploding. It's moving fast, but it's also being adopted, and it's being adopted by a broader demographic. So that's a critical component that people need to keep in mind as they do adopt mobile strategies.
Hey, we've got about a minute to go. I mean, time flies here when we're having fun. A lot to talk about. Rachel, give our audience a couple clean takeaways and how they can connect with you guys, please.
Sure. I think the big takeaway here is when looking at your mobile strategy, think big and then dive in. Look, Steve talked about look at how your mobile strategy is part of your organization's overall strategy. Also understand where you are with mobile and where you want to go, and then develop that plan and then go in before getting tactical. And again, it's a quickly changing industry. Healthcare is got a lot of catching up to do, but I think it will do it very fast, and it'll be exciting to see it along the way.
Well, thank you all for joining us on the program today. Have a great weekend, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.